Hi, it's Dr. Alsobrooks. I just wanted to give you a quick word about cough medicine. So, I've gotten a request or two or 12 from some patients regarding this. So, I thought I'd just share it with everyone. So, first and foremost, there are different types of cough medicine, and there are coughs that occur for different reasons. And so, we want to make sure that we pay attention to those reasons and that we're able to get down to the heart of the matter as much as possible. So, first and foremost, there are medicines called cough suppressants. And so, cough suppressants basically just suppress the cough. Now, cough is a symptom often of another problem. And so, generally, what I say about cough suppressants is it's like turning off the smoke alarm. It doesn't stop the fire, it just makes it so that you don't hear the alarm. Okay. So while cough suppressants are very popular, I don't often recommend them as a treatment, especially long term for cough. In general, what I recommend is that you use cough suppressants sparingly and for specific reasons. If you have a job where maybe you have to give a talk or something like that, or you're running a meeting virtually or in person, and you need not to cough for a specific amount of time, that is a good reason to use a cough suppressant right then and there. I've had people that have coughs that are non-contagious. We know that they're not having any issue that they could pass to someone else, but they might need to board a plane or be in close proximity to someone for a specific amount of time. In those cases, we generally recommend that you use a cough suppressant for that time. And then after that, you go to whatever other treatment that we have for that. So cough suppressants are generally, there's two kind of main ones we use. One is an over-the-counter dextromethorphan, and then the other is one that's often prescribed, and that's the benzonatate. And so you'll hear that one. That one's like in Tessalon pearls and things like that. So using cough suppressants are okay, but only for short periods of time and in specific circumstances. Cough expectorants or expectorant medications. Expectorants are used to help thin the mucus so that you can get it out of the chest easier. So in general, I like these, especially if you have a productive cough. That productive cough basically means that you're generating some sort of secretions, phlegm, mucus, whatever. And so using medications that can help with that, like guaifenesin, that's one of the expectorants, generally helps. Other things that you can do that are over the counter are drink more water. Water helps thin the secretions. Proper hydration helps thin the secretions, I should say. And then also avoiding things like dairy. Dairy tends to increase secretions, and so you just want to be careful. You definitely want to be able to get whatever secretions that exist out of the chest. I'd rather have them out than in. So in general, if you have a productive cough, like a cough that has phlegm or mucus associated with it, I do not want you suppressing that cough for long, because basically all that's doing is telling your body, don't worry about it. Just don't cough, and your body's like, no, but I need to get this out. So thinning the mucus helps get it up and out easier. If the issue is something like you're just producing a lot of bronchial secretions, maybe because you've been a smoker in the past, or you have some kind of condition that doesn't allow you to get the secretions out easier or easily, you may want to try something called ipratropium, and that's something that comes in an inhaler and a nebulizer form, and that also helps to break up the secretions. There's also something called acetylcysteine that also is known to help break up mucus and things like that. Those are prescriptions, though. So you definitely want to talk to your doc and make sure that if those are right for you, that they can get you access to those medications. Additionally, cough that is associated with watery eyes and runny, stuffy nose, that can be allergy related. It can also be related to other things, so make sure you get all your proper testing. That's all I'm gonna say about that. But those symptoms are often helped with antihistamines, and that might be stuff like Zyrtec, Allegra, Claritin, even something called chlorpheniramine or Chlorcon back in the day. So those are medicines that help and generally are pretty non-drowsy. Benadryl at night also can help and decrease some of those kind of allergy-related symptoms. If you are having wheezing with your cough, that's a bit more serious. So if you just focus on my mouth, you see air coming out, I'm not wheezing, stuff's moving in and out. But if I do this, if I try to whistle, then you see that the airway gets a lot smaller. And that is what's happening if you're wheezing. Basically, your lungs are whistling. Your airway is a lot smaller. And that is not a good thing. And anybody that's wheezed or that's had asthma symptoms or any other condition where it makes your lungs wheeze, it doesn't feel good either, usually. Sometimes you don't know, but it's generally not something that makes you feel good. We definitely want to get that airway open because breathing is important. And so we usually do that with medicines called bronchodilators, things like albuterol, levobuterol. Those are medicines that we use a lot for those things. Those are available by prescription. We also try to reduce allergies because allergies can sometimes cause that. So even antihistamines or leukotriene inhibitors, things like that, certain allergy medicines we might use to help prevent that from happening. So those are some medicines that we use for cough and wheezing. If you have cough and vomiting, that's a thing. And those of you that know, that can be associated with reflux. And one of my sons actually has this issue. And I know the cough. When he starts doing a certain cough, I already know, go get the Pepcid, go get the Tums. So, and he already knows too. Now he's starting to recognize it. So these are things where the acid that's supposed to be in your stomach starts traveling all the way up your esophagus where it's not supposed to be, to the back of your throat, and tickles the area where the cough reflex is generated, and it makes you cough. And so if that occurs, the way to treat it is basically to get the acid to go back to the stomach where it belongs and stay there. And so you may have to have acid reducers, acid blockers, all those good things. And so things that you can use over the counter might be something called famotidine, same as Pepcid, or Tums or something like that to get it to go back down. Other medicines you want to be careful of because sometimes the workup for what's causing that can be stalled a little bit if you use the wrong medicine, and it can mess with the testing that we use for that. So just be careful. Talk to your doc. And then other issues such as like cough at night, a lot of times that can be associated with certain asthma symptoms or even just getting too hot. Sometimes, especially when it's really cold, you might have an electric blanket like I do. You might wear your extra warm pajamas, have a couple of regular blankets on the bed, turn that heat on. Then you get in there, you get your body heat to, just turn up just a bit more. And then in the middle of the night, your body goes, can't take this, and you start coughing. And so in those instances, what I recommend patients do, kick off all the covers, take off your shirt right away within seconds. And a lot of times that really helps quiet the cough. If it doesn't, then you may want to consider a bit of the inhaled medicines to kind of help open up the airway, because that's likely what's happening. Alrighty, so there are other special conditions that you have to be careful for. So high blood pressure, certain medicines can actually make high blood pressure worse. So try using things like chloracetine HBP. And that HBP is for high blood pressure. So it's for patients that have high blood pressure, so it doesn't drive up their pressure. You also might have to watch out for things if you're a diabetic. Certain cough syrups may have additional sugars in them, or they make your sugars go nuts. So just remember, you're looking for sugar-free stuff if you're looking for a liquid form. Pill forms might be better for those folks that have blood sugar issues and things like that. All right, so it's probably more than you ever wanted to know about cough medicine. And so when people ask me, well, what kind of cough medicine do you want me to use? First and foremost, look for an expectorant if you're producing any type of phlegm, okay? Not just a cough suppressant. Remember, expectorant is guaifenesin. That's the over-the-counter one, Guiafenesin, guaifenesin. Flip that box over, take a look. That's the one that we're generally looking for to kind of help break up any mucus. Additionally, you want to drink fluids and avoid dairy. Okay, so that'll help break that up. Also, if you're wheezing, especially if you've already been prescribed it. If you've already been prescribed albuterol and you're not taking it, make sure that you get your medicine on board like you're supposed to. And then if there's any reflux involved, make sure you hit that Pepcid or hit those Tums, get that under control. And then if things are happening because you're getting too hot, just cool yourself off. If it's at night and you're under the covers, kick them off. If you're in a really hot building with no AC, go somewhere where there's AC, things like that. All right, well, this is Dr. Alsobrooks telling you more than you ever wanted to know about cough medicines. Bottom line too, see your doctor. We have all this knowledge in our head. We want to share it with you. We don't want you to suffer. All right, be well.